The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
The vaccinated have had enough of the unvaccinated. Trouble is, the feeling is mutual. Tonight, how to proceed. First up, gaps that COVID-19 exposed about health and vaccine equity issues in this province. We'll tackle that. It's Tuesday, January 18th, and that's next on the agenda. COVID-19, as we all know, has not hit everybody equally, and that's prompted efforts to bridge gaps and improve access to vaccines, testing, and such. Now, Omicron has raised the stakes even more. With us for more, from the provincial capital, we welcome Dr. Andrew Boozary, Director of Social Medicine and Population Health at the University Health Network. And I've seen you on so many other channels, I can't believe we haven't had you on before. So welcome for the first time to the agenda, Dr. Boozary. How you doing?
I appreciate it. Thanks so much for having me. And, I think this has been much longer than anyone hoped, but appreciate having the chance to have the conversation.
Not at all. Let's start here. How has access to COVID-19 testing in particular been, in your judgment, inequitable so far as Ontario's Omicron wave is concerned?
Yeah, I think one of the things, Steve, that has been really clear, throughout every wave, through each wave, is that there has been real barriers for people trying to access healthcare and supports and help. And this is one of the things that we've seen play out early on with PCR testing. We've seen it play out with access to the vaccine. And now we're really seeing it again with access to rapid antigen testing. And it's been, such a challenge and been such a burden for people to try to get access to testing that we've seen, throughout the country, chief medical officers of health describing it as really a privilege or a luxury. And this is one of the things that has been, again, speaking to this tale of two pandemics of power and privilege, of profit and people. And when we're seeing these divides in terms of who has the luxuries and privileges in a pandemic, this is where we're seeing, again, this widening in the health outcomes and the health access that we know is so crucial in a pandemic.
Now that's testing. Let me ask you about vaccination, because overwhelmingly the story we hear these days is if you haven't been vaccinated, it's because you're trying to make a political statement or you're nervous or hesitant or something. The story about people not being vaccinated because they might have a social or economic barrier to doing so, does that exist in any kind of significant numbers?
Yes, I think it's still very real for people. I mean, I think this is one of the challenges when you try to have a reductionist view or try to put one moniker or one tag on, different people's realities and different people's lives. And I think when we have to be honest again about speaking to the real setbacks and barriers that we have in our universal healthcare system, which is not so universal for everyone, which I think is one of the very clear learning points, I hope, throughout this pandemic, is that people have very different experiences, have very different histories with the healthcare system. There's different levels of trust. There's also, again, real barriers in terms of people's fears, in terms of being able to continue to work or take time from work. And again, I think when we're looking at some of the data, it continues to be, marginalized communities who rightfully have mistrust with the healthcare system that has not put their interests first. And people are now having to navigate these really hard decisions about wanting to put their loved ones and themselves first. With changing science, changing data, a lot of complexity. And so again, I think we have to have a little bit more nuance, a lot more understanding and compassion as to why certain people aren't coming forward. Of course, all of us are tired. All of us want to see people step up to be able to do the right thing. And we've seen the dramatic impact of vaccines and being able to keep people out of hospital, out of the ICU. We know this has real impacts on other people who need other services and other procedures. So there really has to be an element of how we're pulling together and being able to ensure that people are able to get the questions they need answered.
But when they see numbers such as nearly 90% of people in the province of Ontario have been double vaxxed, why do you think, the government may be powerful, but they can't brainwash 90% of the people, presumably. So why does that not ultimately change the decision that those who, for not political, but for other reasons, won't get vaccinated, why isn't that having an adequate influence in your judgment at the moment?
Well, I think it's a really important point that you raise. I mean, I think we can, continue to look at areas where we need to see improvement and be able to have better outreach and be able to have different ways in communicating and being able to have, as mentioned, people have their questions answered. And we've seen that it's not always a healthcare provider. It can be community ambassadors, community leaders, faith leaders, and we've seen incredible leadership, as you've mentioned, to get to 90% of the population that's double vaxxed. So that's an incredible story in terms of what efforts have happened on the ground to get us to where we're at right now. I think the challenge, what we're seeing with Omicron, especially about how transmissible it is it's really putting people who are unvaccinated at risk. There's higher numbers of people who are unvaccinated in the hospital and ICU. And when we're looking at staff shortages and the real stressors on the healthcare system, it has an impact on everyone. So I think, to your question about how do we ensure that more people are stepping up to get vaccinated, I think, other policy measures have worked. There'll continue to be people who have, the reticence to do so. But, just for me personally, in the last week, there are a few people that I've known for many years that have stepped up to get their first vaccine. So there's still the opportunity here for people to not only change their minds, but be able to be better informed and also better understand what stressors are on the system and the part that they play in ensuring that we get through this. And I think that's becoming more evident for some folks. And again, some folks are just never going to want to be vaccinated. And those are different decisions, and those are different policy calculations.
Just out of curiosity, the people who, for whatever reason, managed not to get vaccinated for the last 13 months, but who just did, those people that do you know why they ultimately decided this many months into this pandemic to finally come forward and take it?
Well, I mean, I think for some of them, they're seeing that it's more real. They're able to know more family members or friends who are being infected. I think that they've had fears about the vaccine, some of them wanting to be able to speak to, a healthcare provider or someone else to be able to get their questions answered, be able to do, some of their own due diligence, but be able to have, the opportunity to have that conversation. I think one part that we've not fully embraced is that, not everyone has access and the privileges the way that, it may be reported. There are people, so many, I think maybe 10% is the latest number. It might be higher. Again, it's hard to tell with the pandemic as there's a lot of change in our health services data. But people are without family doctors or without nurse practitioners, do not have the continuity of care that they want with a healthcare provider to be able to have that trust, to have some of these conversations. So these are crucial conversations. These are questions that people are making about their own lives. Again, it's about a collective responsibility, but not everyone is as plugged into the system or has the trust with the system or has healthcare supports and social supports around them to be able to have these conversations at a time when would have been ideal. But there's still hope in the sense that people are stepping up to do this. There's obviously a lot of division out there and a lot of vitriol that makes some of these conversations really hard. But that's where I think, for many of us who've been doing some of this work on the front line, it's to continue to have no judgment, be able to be open and get the information, the vaccine out to where people are at.
No, I appreciate that. And again, I want to take politics out of this conversation and just and really focus on the reasons that some people might not be vaccinated that don't have to do with politics. And I wonder now, for example, if the Minister of Health were here, she would say, we've taken every possible step to make access to vaccination as broad as possible, pop-up clinics and in hospitals and, at hockey arenas and everything. And I just want to be sure I'm clear. In spite of all that, do you think the government has taken adequate steps to ensure access to vaccination for some of the groups that you've identified who might typically be either suspicious of the healthcare system or not have a family doc to rely on?
Yeah, there's no question, Steve, that there's been really important outreach. There's been investments. There's been community leadership to get the vaccine out to where people are at. So the initiatives that you mentioned, many of us have been involved with in terms of the pop-up clinics, some of the mobile solutions. These are efforts that have saved lives. There's no question in terms of, especially around the innovations that have come from community. And I think when you go back, full circle in the discussion about testing, this is where initially testing came out really either available at hospitals or pharmacies with the COVID assessment centers. But we saw incredible community leadership to say, well, these are the barriers that people, may not have paid sick leave, may not be able to go out to a hospital, may not trust their experience within a hospital or other healthcare setting. And we saw the testing go out to parking lots, to places of worship, to be able to have community ambassadors that have been the real drivers of being able to get that information and that access out. I think one of the elements that we also have to have humility about is with respect to, this has been over the course of the past year, and as you mentioned, or 13 months. And that can seem like a really long time, that people have opportunities or ample opportunity to go and get vaccinated. But when we're talking about mistrust with a system, this spans decades for certain communities, for certain populations. And so just the fact that we're starting to see, some people, because of these efforts, because of community leadership, step up to get vaccinated, see different approaches with how they're going to take care of one another with the vaccine or with other public health measures of masking and other efforts that, again, before the pandemic was not really on the radar. That is really significant, but we're not going to erase the mistrust of decades within 13 months. And that's part of the humility that we need in terms of being able to understand that there's going to have to continue to be more work, continue to be more effort. And we have to meet people where they're at with the same commitments. I mean, we're asking people who've been marginalized and shut out of the system, who have not been cared for, who have not been a priority, to say, well, you now are a priority as a government or a policymaker. But some feel that they may step up, get vaccinated, but then what happens? Where's the supports? Where's the trust? And what happens now when people may feel like they're left on their own? So this is part of that journey. And I think, it's many of us want to be seeing this 13 months. It's a long period. We've all been through this for such an incredible long period of time, but it's something that we have to take within the context of the decades, if not centuries, of mistrust that is in our society and is within healthcare itself.
I should ask you about, I guess, what is the most controversial idea out there right now? And that is, if we believe that it's the best thing for society for as many people as possible to get vaccinated, should we fine those who won't?
Yeah, I don't think that this is the right approach and one that we need to be doing right now, especially when, again, there are still people who are stepping up to get vaccinated with other measures and efforts. I mean, I think there hasn't been a lot of clarity also about this discussion about fines. I mean, we've not seen anything by the way of substantive public policy on this. The issue that many of us may have with respect to fines, and one that I do, is that if it's tied to healthcare access or healthcare utilization, I find that very troubling. I think it really undermines the principles of the Canada Health Act. It undermines this very thing that we've been talking about, making the healthcare system more universal, more inclusive. And when we think about things like a fine for people who may not be vaccinated now, it's a very regressive policy, especially for the challenges that people have already have. And when we look at some of the data, again, around the socioeconomic gradient, the socioeconomic impact that COVID is having, the disproportionate impact the policies are having in terms of the response. To add a fine only, I think, further, it is punitive. I don't think it speaks to the values that we have in terms of ensuring that our system is universal, that it continues to allow people to make the decisions they want, but that our healthcare system needs to be there. I think it also opens up a whole host of real issues and things that are very problematic if we start saying we're going to levy fines based on people's healthcare utilization. And that's not a path I think that we can or should go down as a country. I do think we need to continue to fight for putting the best information that's possible out there, to be able to have other measures and other ways to ensure that people are having more opportunities to get vaccinated, and also to keep safe. I think this is one of the elements where, again, there's so much frustration, there's so much exhaustion in the healthcare system, but we have to be really mindful of what our policies can do, who our policies impact, and the context and the historical context of who's already been most punished through this pandemic. Before, there's this view of sort of populist fines. Well, I think we all want to see people who've not been able to contribute the vaccine or putting other people at risk to step up. But this is really something where we need to be thoughtful before running into these kind of measures that can really undermine the entire premise of our healthcare system as it currently stands.
I'm afraid I'm down to my last 20 seconds here, but I do want to ask you about what the most important thing you've learned over the past couple of years has been in terms of getting appropriate pandemic response healthcare to those groups that normally can't access it as easily as others.
We have to put health equity, and by that meaning removing the fundamental unfairness, right at the center. We have to be having this part of every policy and every way we deliver care to ensure that it gets to people who need it most. The fact that we've had a recent rollout and that we've not seen the learnings to say, well, it's open to everyone 18 plus, that is a mirage of universality. That is a mirage of fairness. And so we can best understand that there are people who continue to have these systemic barriers that are continuously punished by the structural determinants of health. We need to ensure that this is the focus, that this is the real deliberations, and implementation is key in these policies that really puts people who've been marginalized first and at the center. If we do not do this, we will continue to see not only the health gaps that we've seen pre-pandemic, but what worries many of us is actually a widening in the health disparities. And that's something that we just cannot afford right now, given all of the hurt and this pandemic of suffering that people have been through.
Dr. Andrew Boozary, University Health Network, thanks for coming on to TVO tonight and sharing your views. We're really grateful.
Really appreciate it. Thank you so much, Steve.
By huge majorities, Canadians got vaccinated as early and as often as they could, but a significant fraction of the population doesn't want to, and both sides seem to feel equally hard done by the other. Joining us now on whether it's time to change direction in dealing with the unvaccinated, and as is our custom, we'll introduce our guests from furthest away to closest to our studio, starting in Vancouver, British Columbia, with Gary Mason. He's the national affairs columnist for the Globe and Mail. In Montreal, Quebec, Dr. Christopher Labos, epidemiologist, cardiologist, and a contributor to the Montreal Gazette. In the nation's capital, Rupa Subramanya, columnist at the National Post and Nikkei. And in Ontario's capital city, in North York, Roman Baber. He's the independent MPP for York Centre. And we're delighted to welcome all of you onto our program tonight. Some first-timers here, so we're really delighted to have you all. Let's set up our discussion with a look at some of the latest COVID-19 vaccine uptake in both Canada and the province of Ontario. And these numbers represent people who are eligible for the vaccine, meaning anyone aged 5 and up. And here we go. Fully 81.7% of eligible Canadians are fully vaccinated, and only 11.7% have not received a single dose. And if we look at the province of Ontario in particular, we're a little titch above the national average. 81.8% of the eligible population have received 2 doses. 12.2% have not been vaccinated at all. The unvaccinated are admittedly a small percentage, but let's remember that still represents several million Canadians. Gary, get us started. How much patience do you still have with the unvaccinated?
Very little at this point, I would say. I've certainly given them time to educate themselves, to be pandered to by governments, offered prizes, offered trips, and nothing seems to work. I think, to be fair, Steve, there are sort of 2 camps within the unvaccinated. I think there are other zealots who will, rather die than have the vaccine put in their bodies. There are others who I think are simply maybe hesitant for cultural reasons, or they have been misinformed because of what they've read on social media or on the internet someplace. So, I mean, there are 2 camps. But I think more generally, Canadians have just kind of had it, with this group, and they, we want to move on. We don't want to read stories anymore about hospital wards being overflowing with, unvaccinated. At least the intensive care units. So my patience is pretty much empty at this point.
You do make the distinction between the two groups, and we'll come back to that later in our conversation because that is an interesting and important distinction. Rupa, would you follow up on that and let me ask you whether you think the unvaxxed need to be ostracized by the rest of society?
No, I don't think they should, and that's the wrong approach to be taking. In a free society as ours, individuals make choices for themselves consistent with the rule of law while respecting others' right to do the same. Now, it's a fair argument to make that the unvaccinated create a major negative externality because they suffer more severe disease and they're disproportionately represented in our ICUs. But here's the thing, other choices routinely lead to hospitalizations, ICU admissions, and perhaps even deaths, such as drug abuse, alcohol abuse, heavy smoking, morbid obesity. Yet, I don't think anyone serious has suggested that such individuals ought to pay a special tax or a fine, even though these things burden the healthcare system. And also, let's keep in mind that Omicron has proven to be highly transmissible and immune escaping. So both the vaccinated and unvaccinated are catching it and transmitting it. I think the unvaccinated are being made a convenient scapegoat for other massive failures in the system. Here's one astonishing fact. There are more than 2,500 people in hospitals across Ontario today who on average are waiting for more than 3 months to get a placement at a long-term care facility. Another 500 or so are waiting for home care. These folks, through no fault of theirs, are using up scarce hospital resources, including beds, staff, etc.
You know, the Prime Minister has weighed in on this from time to time over the last many months, and let's play a clip of him. This is him on a Quebec-based television program discussing the issue of the unvaccinated. Sheldon, the clip, if you would, please.
Oui, on va s'en sortir de cette pandémie par la vaccination. Puis on en connaît tous des gens qui sont en train d'hésiter un petit peu. On va continuer d'essayer de les convaincre. Mais il y a aussi des gens qui sont farouchement opposés à la vaccination. Qui sont extrémistes. Qui croient pas dans la science, qui sont souvent misogynes, souvent racistes aussi. C'est un petit groupe, mais qui prend de la place. Et là, il faut faire un choix en tant que leader, en tant que pays. Est-ce qu'on tolère ces gens-là?
Yeah, that's the sort of famous racist, misogynist quote that got so much play after the Prime Minister said it. Roman Baber, let me get you in here at this point. To what extent do you think that the vaccinated people of this country have made the unvaccinated their so-called basket of deplorables, as Hillary Clinton might have put it?
Well, the language from the Prime Minister is very unfortunate. At a time of crises, leaders supposed to demonstrate and encourage unity. Unfortunately, the language from the Prime Minister is hateful and very divisive. And in fact, I am somewhat perplexed that we're at this place in Canadian history where we demonize an identifiable group of people. It's not warranted by virtue of the science, the progression of the pandemic, and public policy altogether. I am pro-voluntary vaccination. I'm vaccinated myself, but we have never forced anyone to do anything against their will, nor does there seem to be a strong public policy rationale for mandatory vaccination. We know that Omicron transmits among fully vaccinated individuals. That's according to the Chief Medical Officer of Health. And so the premise behind the passports and the mandates, which is to keep each other safe, is now no longer on the table. As for protecting one's own, I absolutely encourage folks to vaccinate to get the protection that the vaccine offers. But looking at the daily numbers, we see that hospitalizations in Ontario, excluding ICUs, are on par with the vaccinated population. More than 70% of those occupying Ontario's hospitals today are in fact fully vaccinated. And the ICUs are about even and trending in the vaccinated direction. It's clear now that we are unable to fully exit the pandemic just by virtue of vaccination. What we need to do is we need to stop scapegoating people and exhibiting the type of language previously unheard in Canada and focus on building hospital capacity and hospital resources to help us deal with future waves.
Let me just do a quick follow-up with you, Roman, though. If the ICU capacity right now is equally shared among the vaccinated and the unvaccinated, and the vaccinated are obviously a significantly larger portion of the population, then we can conclude that the unvaccinated make up a disproportionate amount of ICU beds right now, right?
You're absolutely correct. So we have 100, as of yesterday, we had 195 unvaccinated patients in ICU. Surely 200 patients for a province of 15 million people is no reason to redesign our democracy and no reason to get away from the primary objective of the Canada Health Act, which is to facilitate reasonable access to healthcare without any financial or other barriers. This discussion or the proposal to either subject the vaccinated to different rules or limit their access to healthcare or impede their healthcare in any way, whether by financial requirements or otherwise, is a clear violation of the Canada Health Act, and it will lead us down a very, very slippery slope whereby essentially Canadians will be precluded from making their own healthcare choices.
All right, Christopher, thanks for your patience in waiting for your turn to get into this thing. And let me just follow up on what Rupa had to say and get you to comment on that, because she certainly gave a long litany of what's ailing the healthcare system away from all of this issue of vaccination. So in your view, how much should the unvaccinated be primarily blamed for the situation we find ourselves in right now?
Well, so I never like using the term blame because it implies that it's people's fault or that we're attacking them. But I think we can say very clearly that the higher the vaccination rate the higher the vaccination rate goes, the less COVID we have. And I think if you want to look at an example, look at what's happening in the US now that, arguably has a more robust healthcare system than we do, definitely pour more resources into their healthcare system in terms of having larger hospitals, more staff, more equipment. And yet they are also being overwhelmed by COVID right now. So pouring more resources into the healthcare system is obviously important. We need to resolve a lot of the chronic issues that we've been dealing with, frankly, for the past 20 to 30 years. But I would propose to you, in an arguably better position than the US is right now because we have a higher vaccination rate. And that makes a big difference. It's not the only factor at play. We obviously have to deal with the issues of staffing shortages. We have to have access to testing. But the Omicron variant is just such a significant threat in terms of its increased infectiousness and the fact that it can overwhelm the system, that the more unvaccinated people you have, the more people end up in hospital. And at a certain point, you can't keep expanding the hospital system infinitely. You can't, it's very hard to build new hospitals, but it's also very hard to train new staff. So just expanding the healthcare system to accommodate the wave of people who are going to get sick is not a sustainable long-term strategy.
Let's do a little comparing and contrasting with what other countries are the kind of approach they're taking to try to get people to vaccinate. And Gary, I'll get you to comment on this first after we go through this list here. Sheldon, maybe you can bring this graphic up and we'll go through it. In Italy, for example, vaccination will be mandatory for citizens 50 and older with some exemptions, but those who refuse could face fines ranging from 680 to 1,700 Canadian dollars, and people could lose their salaries as well. In Greece, they are expecting mandatory vaccination rules for citizens over the age of 60. In Austria, which has one of the lowest vaccination rates in Europe, those over the age of 14 will face compulsory vaccination, and fines there could reach almost 10,000 Canadian dollars. Okay, we had a little hint of this in Quebec last week. Gary, in your view, is this an approach we should take here?
I think it's an approach that we should certainly consider. At some point, people, reach the end of their rope here, and they demand more action from their governments to get these last holdouts to get vaccinated. One thing that, Steve, I think that needs to be pointed out here, in terms of, we don't want to demonize the unvaccinated and we don't want to treat them unfairly. But nobody's talking about the hundreds of thousands of surgeries that are being postponed right across this country because ICUs are full up and hospitals are full up. Granted, some of them are with vaccinated people, but those people are in and out in a day or a couple of days. It's the ICUs that are really causing a lot of the heartache. There are people with stage 4 colon cancer who are having their surgeries delayed week after week after week because somebody, read something on the internet and decided not to get vaccinated, and now they're in an ICU. And I think people just see the fundamental unfairness of that. And I think, as a Canadian who, is trying to, think of the greater good here, I'm fully in support of anything that forces these people off their couch and into a vaccination clinic and finally get jabbed.
Rupa, can I get your view on that? What about significant fines for those who refuse to be vaccinated?
Well, first of all, Steve, I think it's still early days to say if mandates and fines work. Austria and Germany, for example, have announced vaccine mandates, but they're still far from being rolled out, and there are already logistical and legal challenges. And in places like Greece, which has already rolled out its vaccine mandate and fines, these decisions have been very polarizing, and many of these countries have been gripped by protests. Also, let's keep in mind that the unvaccinated have already been paying an implicit tax by being denied access to restaurants, theaters, etc. So if anything, I think this has entrenched their opposition to vaccine mandates, either whether you're doing it through the front door or through the back door. And also remember that coronavirus mutates, and therefore the original two-dose course is never going to fully protect you for a lifetime. So how does a vaccine mandate work with a carousel of boosters that one would have to take? I mean, it becomes a bit ridiculous after a certain point. And really, what is the end game here? But what has also really puzzled me in the Quebec context is that they haven't mandated vaccination, but yet they're going to tax those who haven't been vaccinated. It's a bit like saying it's not mandatory to get a driver's license to drive, but if you choose not to get it, we're still going to we'll tax you. So the question here is, why hasn't a vaccine mandate been forthcoming? And I suspect it's because if a province goes ahead and does this, especially with vaccines that have been approved under emergency orders, which also have had known issues, especially in certain age and demographic groups, it's going to elicit a lot of legal challenges and may not survive constitutional scrutiny.
You did mention what's the end game here, and I do want to pick up on that with Christopher, because we've been told over and over again the end game is to make sure that enough of us are vaccinated so that we stop putting pressure on our hospitals and our ICUs. In which case, do you think Quebec's onto something when they say we are going to start to fine people? They haven't been specific yet, but we're going to start to fine people who don't get vaccinated because they're clogging up our hospitals. And as someone else suggested, Gary said it a moment ago, we've got people with stage 4 colon cancer in this province who can't get into an ER or an ICU right now.
Right. And listen, I think this is definitely an issue that needs to be discussed. And the Premier has said this is going to be discussed in the Legislative Assembly here. It's going to take a while to implement. It actually probably is. We probably don't even have enough time to implement it for the current tax year, because tax season is coming up sooner than any of us, I think, would like to admit. But I think it's an important issue to discuss because there's sort of two different approaches going forward. One is this health contribution that the Premier has talked about. And the other one is to just expand the vaccine passport system. And Quebec has also been doing this. They first started applying it to liquor stores and cannabis outlets, and now to big box stores. And what we've seen is that every time the government announces an expansion of the vaccine passport system, more people go out and get vaccinated. If you can demonstrate to people a practical benefit as to why they need to get vaccinated to do X, Y, Z, they will go out and do it. So there is this small hardcore of anti-vax sentiment out there, but there are also a lot of people that, for a variety of reasons, probably misinformation or stuff they've read on the internet, have decided not to get vaccinated because they're not that worried. They think COVID is a mild illness and that it's not something they need to worry about. But if you give them a practical reason to do so, they will. So maybe that's a fine. Maybe that's the vaccine passport system. And I think it's important to have the discussion, because what we have to do is change the conversation from vaccines about something that it's up to you, your own personal choice, to something that is part of the common good. In the same way that we've passed anti-smoking laws to, limit the exposure to secondhand smoke. We have to start realizing that vaccines have a benefit not just to you as an individual, but to society as a whole.
Roman, I'd like to know what your solution is to the problem of people who refuse to get vaccinated, end up in our ICUs, and as a result, we've heard some of the most egregious examples, people who can't get treatment because the system has had to pivot to take care of COVID-19 patients. What do we do about that?
Well, the question first and foremost is whether the strategy of mandatory vaccination will get us to a desired destination. We know, as I've said earlier, that more than 70% of folks occupying Ontario's hospitals today, ICU excluded, are fully vaccinated. There are about 195 patients in Ontario's ICUs today who are unvaccinated. To suggest that that should put the type of pressure on the system where Ontario's healthcare system is unable to survive just speaks to the failure of the system and to the government's failure to ensure adequate capacity and staffing 2 years later. As I've said to you a year ago, a lot of our capacity issues are actually artificially caused by acts of government. So for instance, we have suspended, not the province, but hospitals and hospital administrators suspended thousands of unvaccinated healthcare workers, despite the fact that they transmit Omicron just like their vaccinated coworkers. We have isolation protocols, very onerous COVID contact and isolation protocols, which artificially decrease capacity by having healthy workers sit at home. We have Bill 124, which caps pay increases for nurses at 1%, which is 3 to 4% below the rate of inflation. We are doing everything, the Ontario government doing everything possible to discourage capacity. But what we tend to do instead in the last 2 years is assign blame, whether it's folks that hold the Canadian flag outside of Queen's Park outdoors, even though their province cannot show a single case of outbreak outdoors, or it's folks that want to have a car parade in Wasaga Beach, or Adamson Barbecue, who wants to sell brisket, even though small business is not responsible for the spread. We tend to blame everyone but ourselves. What we need to focus on is the fact that this is a very transmissible virus, and we need to make sure that we build enough healthcare capacity and staffing capacity to deal with whatever comes, and that hasn't happened.
Let's go back to something Gary referred to in his very first answer, which is the notion that there are really two different categories of people we're talking about here. And to that end, I want to get a better sense of who the vaccine hesitant are, as opposed to the out-and-out anti-vax conspiracy types. Abacus Data polled thousands of unvaccinated people, and here are some of the responses they came up with. This may surprise you. They have an average age of 42 years old. 59% of the vaccine hesitant are women. Approximately 66% say they've got a post-secondary education degree. More than 60% say they sit at the center of the political spectrum. 35% vote Liberal, 25% Tory, 17% New Democrat. Now, let's flip that over and look at the intense anti-vaxxers. These are the people who are not going to take it under any condition. COVID is a hoax or exaggerated. 34% of hesitants agree with that, but 73% of staunch anti-vaxxers agree with that. How about the question of they hate government telling them what to do? 85% of vaccine hesitant people say yes to that. 90% of anti-vaxxers say that. And meantime, 17% of vaccine hesitant people say they don't trust their doctors. That's why they're not getting it. 40% of anti-vaxxers say they don't trust their doctors, and that's why they're not getting it. Let's start with this. Gary, do we have the right people in mind when we talk about an unvaccinated person?
Boy, that's a great question. I mean, I've always believed that the unvaccinated, it was a plethora of, society. It was a wide range of people. So, I don't know if, we should be targeting specific groups. I just know, Steve, that, we have 10% of the population roughly in Canada that is unvaccinated now. It was a lot larger, not that long ago. It was probably 20%, 30%. Various provincial governments across the country brought in vaccine mandates that kind of, tightened the screws on people and gave them a choice: get vaccinated, or you're not going to have the right to work. You're not going to have the right to go to a restaurant. And it did significantly impact the uptake in vaccinations. So vaccine mandates, vaccine passports, all those measures work. Now, quickly, there's going to be a segment of the unvaxxed, the people that are showing up in front of politicians' homes at all hours of the day with picket signs and talking about, Nuremberg trials and sending threatening notes to journalists. They're going to die. They'll die before they have a vaccine put in their body. I'd say, we're never going to convince them. But, there are others that we can still reach. But it's not going to be through nice talk and gentle persuasion and let's, get them into therapy. I mean, we don't have the time to do that. Like, a pandemic affects all of us. It affects all society. It's not like we're not talking about smokers or somebody who drinks too much. I mean, those comparisons are absolutely silly to make them. This is a once in 100 years pandemic. It takes, it necessitates extraordinary measures. This is extraordinary times. And people have to get that through their heads. A lot of the people are saying hands off to the unvaccinated are sitting in their comfy homes. Their life hasn't really been affected much by it. They don't have a loved one who hasn't had a surgery because of this. So, I mean, I think people have to get a grip here. This is serious. And, it's gone on long enough.
Rupa, what about that notion that this is a once-in-a-century phenomenon and the majority have to be prepared, or I guess in this case, a small minority have to be prepared to forego some of the civil rights they might normally enjoy so that the vast majority of people can feel safer?
I completely disagree with that, Steve. From your reading of the stats, it's very clear that the unvaccinated are not a monolith. They include everyone from those who have recovered from a prior infection to professional athletes to your next door neighbor who votes liberal and shops at Whole Foods and wants to control what's going into their body. It also includes people who've come to Canada fleeing despotic regimes and have a personal and collective memory of the harmful effects of government mandates, such as Indigenous people, immigrants from former communist countries, or people who fled war zones, where, if the government tells you to do something, you're immediately suspicious. Let's also keep in mind we're missing an important point here, which is that the vaccines that are currently in use have been issued under emergency orders have had some well-documented issues. So you've had blood clots with AstraZeneca. Some young people have had heart issues by taking Moderna and Pfizer. And these are not conspiracy theories. I think there's a more general point
Rupa, you'll
here,
acknowledge, though, that's an awfully small, tiny percentage of people who've been affected in this way. Overwhelmingly, the vaccination program's been a success, right?
It is. It is. I took the AstraZeneca, by the way, so I fully agree with you, but it's enough to spook quite a number of people out there. A more general point here is that if you distrust the government and big pharma especially, and you're told you'll be taxed or otherwise sanctioned if you don't get vaccinated, it's only going to entrench your opposition to vaccines, especially if they're mandated.
Well, we do know that is true. That has been empirically proven. Christopher, come on in here and tell me whether you think it's important to make a distinction between those who are still, let's call them hesitant, but potentially open to getting vaccinated versus those for whom this is a non-starter.
No, I think you are absolutely correct. We have to make that distinction because those people can be motivated. Unfortunately, though, I don't think asking nicely is going to be enough of that motivating factor. We can address some of the mistruths that they've heard. I've frankly heard a few of them on the program right now. So the idea of emergency use authorization, that is not a Canadian thing. That is something the FDA did temporarily, which has since been changed. They have gotten full approval in the US. Emergency use authorization is not a Canadian designation. That does not apply in Canada. They got full Health Canada approval. The other thing, the idea that the vaccinated people can still transmit the virus as easily as the unvaccinated, that too is untrue. Yes, you can still get sick if you are vaccinated and then transmit the virus to somebody else, but you're much less likely to do so if you're vaccinated, in the same way that you're less likely to get sick and end up in hospital. So we can combat these statements and try to reassure people when they've heard things that are potentially scary. But a lot of people are not going to be moved simply by information because, frankly, they don't watch the news. They're not watching this program right now. They're getting misinformation from the internet. So in the same way, you can educate people about the dangers of drunk driving. Unless you put police on the road to set up roadblocks and give people breathalyzers, you're not going to completely eliminate the issue. So there has to be some form of inducement to doing the right thing. And whether it's the passport or a tax or something else, we just have to change the way we talk about vaccines rather so that it's not simply you get to decide what to do. We have to change it to be something that is mandatory. And by mandatory, I don't mean that people are going to come and forcibly vaccinate you. By mandatory, I mean making it something that everybody has to do and that there are some consequences if you don't do it, like not wearing your seatbelt when you drive a car. The police don't come and buckle you into your car, but they write you a ticket if you don't wear your seatbelt. So we have to start reshaping our thinking in that sort of way.
Roman, let me get you to comment on what I think's been one of the more interesting political developments at Queen's Park over the past year, and that's you. Part of what interests me is the fact that you have been, and you've said it again today, you've been vaccinated. You are following the rules and getting yourself vaccinated. You think it's the right and healthy choice to make. And yet for a variety of interesting reasons, you've become a bit of a champion of the unvaxxed. The people that Doug Ford calls those yahoos on the south lawn of Queen's Park who don't seem to want to follow any rules at all. I'm not even sure what the question is here, other than maybe that are you comfortable being the champion of the unvaxxed in the way that you've become?
I'm comfortable being a champion for all Ontarians who do not have a voice. And regretfully,
that's not what I asked you, though, Roman. I asked you whether you're comfortable being a champion of not just the vaccine hesitant, but the out and out conspiracy people, the anti-vaxxers. They like you.
Well, you just cited an Abacus study that suggested that the hesitant are on average a 42-year-old female with post-secondary education who votes Liberal. So I would not necessarily categorize anyone with a preconceived notion. What I am opposed to, however, is forcing anyone to do anything against their will. What we've seen in the last couple of months is this drive to prevent folks that made a different medical choice from enjoying normal access to daily life, whether it's public transportation, trains or planes, or forcing someone to choose between their own healthcare choice, and we still agree that it's a choice, versus putting food on the table, which is why I brought the Jobs and Jabs bill. I felt always, whether it's children with autism or Canadians that do not have access to their loved ones in long-term care home, that throughout this pandemic, we've been missing the point. Public health has been wrong time and time again, and any suggestion that vaccinating the balance of the 10% will get us out of the pandemic is not grounded in any reality. Public health told us that we're going to exit as soon as we're at 70%, 80%. We're now at 90% almost of eligible Ontarians, and here we are back in lockdown. Passports and mandates didn't work because the places that they were supposed to safeguard are now in lockdown, such as restaurants or gyms, and that spread was not prevented. My focus has always been on demanding better service from government. Government has failed to build hospital capacity, and it is artificially choking hospital capacity. That's the reason we're canceling surgeries. We need to hire back all staff that was let go. We need to end the onerous.
They were let go because they wouldn't get vaccinated. You think it's hang on, Roman? They were let go because they wouldn't get vaccinated. Do you think it's a problem for people who work in the healthcare system providing services that we need not to be vaccinated?
Well, we know that Quebec has now U-turned on this. We know that the Ontario government is considering bringing back unvaccinated workers. And in fact, Dr. Isaac Bogosh himself a couple of days ago called for the return of unvaccinated workers. We understand very clearly from the chief medical officer that Omicron transmits among fully vaccinated individuals. We know that the first two shots probably have a limited effect in preventing Omicron transmission. We see a recent study from Public Health, supported by Public Health Ontario, that suggested that the booster has limited effect on preventing transmission. And so if
but it has a strong effect in keeping you out of the ICU. It has a strong effect in keeping you out of the ICU.
So we're talking about two elements here. One is the element of transmission. If we're worried about transmission to other people, then that argument is off the table, because transmission seems to be similar between, at least according to the chief medical officer now, between vaccinated and unvaccinated individuals, that of Omicron. When we talk about burdening the healthcare system, that is a different argument. But then we get into the question of, well, do we now deviate from the principles of Canada Health Act and create barriers?
I get your point. You've made that point. I'm down to my last 5 minutes. Gary, you've heard what Roman had to say. I wonder if you'd come back and retort that if you choose to.
Well, I mean, I think that the only thing I would say is I think this notion that we have to build capacity to handle the situation that we're in now is ridiculous. I mean, this is a 1 in 100-year pandemic that has forced hospitals, to be burdened like they haven't been burdened in, years and, in a long, long time. Look, at our hospital system needs fixing. There's no question about it. It needs improving. We do need to hire more nurses, more doctors. No question about that. But this idea that we need to build capacity to handle a pandemic is just, it's ridiculous. There's lots of things that we need to do, but I don't think that we need to, add thousands and thousands of beds in the event that we have another pandemic down the road. I think, Steve, to just sort of summarize my feelings on this, the government's responsibility is to the greater good. And if it means ostracizing, or if this means having a negative effect on a small group of people to protect the greater good, I think most Canadians, a vast majority of Canadians, would see that as a right-headed policy and something that they would support the government to do. And that's what's happening now. We do have to simply put the pressure on unvaccinated to go in and get a jab. There's just no other option. We just can't just keep hands-off approach. We just can't keep doing that.
No, I appreciate your position, but of course, there is such a thing as the tyranny of the majority, and we do have something called minority rights in this country, and that's what the charter is all about.
Right.
So, I guess, Rupa, I want to ask you, I think the first people in the province of Ontario got vaccinated 13 months ago. Everybody's heard the arguments about why you should or why you might not want to be vaccinated. Is there any, I mean, we've tried lotteries, we've tried, potentially preventing you from going into arenas or stadiums or, restaurants and bars and all of this. Is there anything anybody can say at this point, Rupa, in your view, that would make somebody who hasn't been vaccinated yet say, oh, the light goes on. I think I'm going to go out and get my jab now?
I think, Steve, at this point, if you're unvaccinated, despite all of those horrific videos of people winding up in the ICUs, and you still don't want to get vaccinated, I don't think anything's going to change your mind at this point. But I still believe an approach based on carrots rather than sticks makes way more sense. For one thing, we don't recognize recovery from prior infection, unlike other countries, when acquired immunity is as old as time itself. In addition, I would say that there's been a massive failure in messaging from our experts and public health officials. In some cases, it's been downright damaging. A few weeks ago, a prominent expert said vaccine effectiveness was melting like snow. And then a few weeks later, he had to backtrack and say that even 2 doses of the vaccine is good at preventing severe disease. So what kind of signal does this send to the unvaccinated? More generally, I feel that there's been a fair bit of fear-mongering, which basically says that the sky is falling. Even for those of us who are vaccinated and boosted like myself, we're back to the restrictions we had in the spring of 2020 and staring at a future of frequent boosters and perhaps more restrictions. So when even the vaccinated are confused and fed up, imagine what the unvaccinated are saying. I'll tell you what they're saying. They're saying, why did these folks get a vaccine if they end up getting COVID? And they're also ending up in hospitals and ICUs and face the same restrictions as us. For the vaccinated, social life has once again disappeared. We're back to restrictions. We're not meeting friends because they're fearful of getting COVID. So sure, if you're vaxxed and boosted, chances are severe illness has lessened. But then you're still a prisoner of the restrictions, and that's not much of a life, is it?
Christopher, can I get you to weigh in on this issue? We've heard just about every argument in the book for the last 13 months on why we should be vaccinated. Do you think there's anything that could still be said that could convince somebody who's vaccine hesitant to get the jab?
Potentially, yes. I've had a few one-on-one experiences, but it's because these people have really bought into the misinformation that's out there. I've had so many people, so many young women speak to me about not getting vaccinated because they're worried about infertility. And this is just one of these myths that just keeps coming back. Aaron Rodgers cited it as the reason why you didn't want to get vaccinated. So it's very hard to combat this stuff. You can eventually do it, but it's an incredibly labor-intensive approach. So it is feasible, but it's not going to work on a broad scale in the same way that if you want people to quit smoking, you know what you do? You pass anti-smoking laws. And does that restrict people's freedoms? Yeah, a little bit, but it makes society healthier. And over time, the feeling of the population changes. Passing anti-smoking
That's the key, though,
laws,
Christopher. The key is with the anti-smoking legislation, it kind of took 20 years before we finally got to a position where smoking was considered really antisocial and people weren't going to put up with it. We don't have 20 years here, do we?
No, we don't. And my hope is that the population learns from the past experiences and that we acknowledge that vaccines are a very helpful strategy. I understand that people don't like the idea of the government telling them what to do, but try to remember the old adage that your freedom to swing your fists ends where my nose begins. The invocation of personal liberty can't be used if your actions cause harm to others, in the same way that you can't use freedom of speech to incite other people to violence. So we have to have a serious conversation about whether vaccines are a public good or an individual medical choice. And I would put the case to you and to everybody that they are a public good. And in the same way that you have to give your children vaccines to attend school in Ontario, we have to make the decision about whether you need to get vaccinated in order to participate in public life.
I'm really grateful to the four of you for participating in this discussion. I got 10 seconds left to ask Roman Baber, who's an independent member of the Ontario Legislature. Are you running for re-election in June?
It's a decision that we'll make over the next couple of weeks.
You're going to give me a call and let me know when you decide?
Happy to speak to you anytime, Steve.
Good stuff. Gary Mason from the Globe and Mail, Dr. Christopher Labos from the Montreal Gazette, the epidemiologist and cardiologist, Rupa Subramanya, columnist at the National Post and Nikkei, Roman Baber, the MPP for York Centre. Thanks all of you for being on TVO tonight.
Thanks,
Thanks, Steve.
And that is the agenda for Tuesday, January 18th, 2022. Tomorrow, how the idea of allyship has evolved and what it means today. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.